This important video is about COVID-19 treatment with plasma from survivors of the infection. 100 years old science being revived. For a layman, I would like to explain what is plasma. There are two major components of human blood, plasma and cells. The blood is about 55% plasma and 45% cells. Plasma contains antibodies, protein-rich components of blood, whereas there are two types of cells which are red and white cells. I just used the word antibodies, which are the components of human immune system. So let's discuss in very brief about this system. Humans protect themselves via immune system having two types. Innate immune system, which are skin, chemicals and non-specific barriers for infectious agents, and adaptive immune system, we get during the course of our life. It is specific, systemic and remember the body harming infectious agents with the capability to fight back quickly, exactly like a trained army. Two components of the adaptive immune system are cellular defense, memory B cells, humoral component, antibodies made by white blood cells present in the body fluid, components like blood and lymph, having capability to fight exactly like patrol police on duty. Antibodies destroy viruses and other infections. Now we come back to real story how plasma can treat patients suffering with COVID-19 disease. Here are a few news items. March 24, 2020, how blood from coronavirus survivors might save lives. New York City researchers hope antibody-rich plasma can keep people out of intensive care. March 25, 2020. The USA Drug Regulatory Authority FDA okays convalescent plasma for treating critically ill COVID-19 patients. March 27, 2020. A Chinese study describing treatment of 5 critically ill patients with COVID-19 with convalescent plasma. To make my point clear, I still feel talking about immune system that saves us from infectious viruses, bacteria and fungi on daily basis. You might have heard the word vaccine. Vaccines trick the adaptive immunity and arm the body against the pathogen. Vaccines behave similar to an infection and the human body produces a defense system against an infectious agent, virus, bacteria, etc. So a strong defense is already existing in the case. The infection comes and trained army is there is to fight with the invader antigen. This is called active immunization. Now using plasma of patients recovering from COVID-19 to treat seriously ill suffering with the same disease is like buying trained army that already defeated an enemy. This is known as passive immunization. People recovering from disease have antibodies that fought with the infectious agent like COVID-19 causing virus. These antibodies are present in the human blood fraction known as plasma. Plasma from a recovered patient can be transferred to one fighting with the disease. It is exactly like fortifying already fighting army to fight with the enemy that is COVID-19 causing virus. Under consideration in this video, passive immunization is quite different than vaccination. Antibodies generated in response to an infection with viruses like polio, measles give lifetime immunity. Patients with SARS virus have immunity for above 10 years. SARS coronavirus 2 is a close cousin of SARS. Animal studies proves reinfection could not reoccur due to passive immunization. But the question is, how long? Support for passive immunization concept in COVID-19 came from a scientific study which says reinfection could not occur in SARS coronavirus 2 infected rhesus macaques. Patients who have recovered have antibodies that can help the people suffering with COVID-19 to overcome their disease. Food and Drug Administration (FDA) allowed the usage of antibodies from recovered patients. As we said earlier, Chinese study confirmed recovery of 5 patients by administering plasma of patients who recovered from COVID-19. In USA Houston Methodist Hospital, Texas first one to inject plasma from COVID-19 recovered people into serious real patients. Saturday, March 28, 2020. 2 patients received experimental therapy. Convalescent plasma therapy should be administered with extreme care. WHO guidelines should be strictly followed. Use of convalescent whole blood or plasma collected from patients recovered from Ebola virus disease for transfusion as an empirical treatment during outbreaks.